ethical and legal considerations in embryology, ethical principles in reproductive medicine, autonomy, beneficence, non-maleficence, and justice. In the field of embryology and reproductive medicine, ethical principles are essential to guide healthcare professionals in their practice. The application of these ethical principles ensures that practices in fertility treatment, embryo handling, genetic screening, and other reproductive technologies are carried out in a way that respects patient rights, promotes well-being, and ensures fairness in the treatment process. This section will cover the four main ethical principles: autonomy, beneficence, non-maleficence, and justice, which serve as the foundation for decision-making in reproductive medicine and embryology. 1. Autonomy. A definition of autonomy. Autonomy refers to the right of individuals to make their own decisions about their healthcare, free from coercion, manipulation, or undue influence. In reproductive medicine, autonomy is critical when making decisions about fertility treatments, embryo transfer, egg or sperm donation, and genetic testing. B. Importance of autonomy in reproductive medicine. Informed consent. Patients must be provided with all the necessary information to make informed decisions about their treatment options, including risks, benefits, and alternatives. Informed consent is a cornerstone of respecting patient autonomy in reproductive medicine. Respecting patient choices. Patients have the right to choose or refuse fertility treatments, such as IVF or genetic screening. Empowerment. Autonomy empowers patients to actively participate in their own healthcare and reproductive decision-making. Ethical dilemmas involving autonomy. Conflicts of interest. Situations may arise where healthcare professionals advise conflicts with a patient's preferences, especially when a patient's choice is against medical advice, e.g., choosing not to undergo recommended testing. Assisted reproductive technologies, ART. Ethical questions may arise when patients seek ART procedures that challenge traditional notions of family or parenthood, such as surrogacy, egg donation, or gender selection. Second, beneficence. A definition of beneficence. Beneficence refers to the ethical obligation to act in the best interest of the patient and promote well-being. In reproductive medicine, this principle requires that healthcare providers strive to achieve the best possible outcomes for patients while minimizing harm. Book: Importance of Beneficence in Reproductive Medicine. Maximizing patient well-being. The goal is to improve the health and reproductive outcomes for patients through appropriate treatments. Providing effective treatment. Healthcare providers must ensure that patients receive effective treatments that will maximize their chances of successful conception and childbirth, encouraging positive outcomes. Professionals must make decisions that promote long-term benefits for patients, ensuring the emotional, psychological, and physical well-being of those involved in reproductive procedures. Ethical dilemmas involving beneficence. Cost of treatment. Offering treatments that might be effective but are too costly or involve significant risks may raise ethical questions about whether beneficence is being prioritized over financial considerations. Embryo freezing. The use of cryopreservation techniques, e.g., egg freezing or embryo freezing, can be controversial when considering whether it provides a benefit to the patient or places undue stress on patients from potential future unknowns. 3. Non-maleficence. A definition of non-maleficence. Non-maleficence is the ethical principle that dictates that healthcare professionals must do no harm. In reproductive medicine, this principle requires that procedures, interventions, and technologies should be performed in a way that minimizes risks and avoids harm to the patient, their partner, and potential offspring. B. Importance of non-maleficence in reproductive medicine. Minimizing risks. Reproductive procedures must be designed to minimize the risk of harm to patients, such as complications from IVF, egg retrieval, or embryo transfers, protecting future generations. The principle of non-maleficence extends beyond the patient to include the potential offspring, ensuring that assisted reproductive technologies, RT, do not result in unintended genetic issues or long-term health risks. Patient safety. Risk assessment and monitoring during fertility treatments are essential to ensure that medical interventions do not cause undue harm to the patient's physical or emotional health. Ethical dilemmas involving non-maleficence. Multiple births. Multiple embryo transfers may result in multiple pregnancies, which carry higher risks of premature birth and complications for both mother and child. Genetic screening. Genetic screening, while beneficial, can pose ethical concerns about the potential for selective abortion or decisions based on genetic characteristics. Fourth, justice. A definition of justice. Justice in reproductive medicine involves treating all patients fairly and ensuring equitable access to reproductive technologies and services. Justice requires healthcare providers to consider the fair distribution of resources and ensure that reproductive rights are respected for all individuals. B. Importance of justice in reproductive medicine. Equitable access to care. All individuals, regardless of socioeconomic status, race, ethnicity, or geographic location, should have equal access to fertility treatments and reproductive health care. Fair distribution of resources. With limited resources, such as IVF cycles or embryo storage capabilities, it is essential to ensure that resources are allocated fairly and not based on factors like wealth or social status. Informed choices for all. Justice ensures that all individuals are provided with sufficient information and support to make informed decisions about their reproductive health, without being discriminated against for their choices or backgrounds. Ethical dilemmas involving justice. Cost of treatment. The high cost associated with ART procedures may result in inequities in access to care. Low-income individuals or couples may be unable to afford treatments like IVF, egg freezing, or surrogacy. Ethical issues in global fertility tourism. Fertility tourism, where patients travel to countries with less regulation for affordable treatments, raises concerns about justice in the global distribution of healthcare services. 5. Conclusion. Ethical principles such as autonomy, beneficence, non-maleficence, and justice are fundamental to ensuring that reproductive medicine and embryology are practiced with respect, care, and fairness. These principles guide healthcare professionals in making decisions that prioritize the well-being of patients, the equitable distribution of resources, and the long-term safety of future generations. Addressing ethical dilemmas in assisted reproductive technologies, ART, requires careful consideration of these core values, which are vital for maintaining trust, integrity, and patient-centered care.